Hello, this is Sunday, November 28th. And of course, I have to talk about the new Omicron variant of the COVID virus today. But before I get into that, I want to go back to something I talked about in the last video, and that was ivermectin. I mentioned a video that Dr. Campbell from Great Britain had made, which he asserted that ivermectin had the same mechanism of action as Pfizer's new antiviral drug that they're looking to get approved, and that it was maybe even stronger. And because I was skeptical of that, I mentioned and that was laboratory studies only. I did my own search and found a meta-analysis of 15 trials in humans with COVID-19, claiming that ivermectin was significantly beneficial in preventing serious illness or death. Well, since that time, another British person, a research doctor, published a video on YouTube. It may well have been prompted by Dr. Campbell's video. And she's refuting some of his argument. She was mostly focused on the laboratory testing, claiming that ivermectin would work against COVID. And she said he doesn't really understand all the details of the how the protease inhibitors work and the different protease enzymes, and these studies prove nothing. But what's more important than that to me is real world evidence. And the problem that may have existed with some of those 15 studies that were part of the meta-analysis, questions have been raised now about some of those studies, that in some of them, the data may have all just been made up. I mean, they may not have actually been real patients, and other ones were very sloppy studies, not well designed. So that's why the researchers in the field of virology still don't feel there's good evidence that ivermectin is beneficial in COVID-19 infection. Also, some of the people who were taking it were really taking huge overdoses, or they were taking it like for prevention on a daily basis, and that's not healthy. It can make you very sick. So we're still so nevertheless, the FDA and some other places are doing better trials of ivermectin to get a firmer answer. But for right now, we have to say there isn't clear evidence that it is beneficial. But back to Omicron, the Omicron variant. I'll talk about what we know, which is not a lot, and what we don't know, and what I think. I think it did originate in South Africa. We can't say that for sure. It was first detected in South Africa. I think probably originated there. It's spreading very rapidly. We know it's been in Namibia and I think one other country adjacent to South Africa, and it's been detected in Israel and most of Western Europe already, like Denmark, Netherlands, Germany, Italy, Great Britain. All of them have had known cases already. This has made such a huge difference to the case rate in South Africa that from November 1st through 2 days ago, November 26th, the number of identified cases per day or per week went up 100-fold in South Africa. Now they can't say that all of those were the Omicron variant, but in the same time period, they also identified, oh, we have a new variant. based on samples that they did carefully analyze. So it's likely that most of this huge increase is the Omicron variant. That also says something about how quickly it has spread to other countries. One researcher, they talked about how much more effective it is. They talk about an R ratio. The R ratio is just basically, if you're sick with some virus, how many other people on average is it likely that you'll infect before you recover and stop spreading it? So with the original COVID-19 virus, the R ratio was looks like about 4.5. On average, one person would make 4 to 5 other people sick. The Delta variant, which was the worst variant up until now, was about twice as bad. So its R ratio was about 8 to 9. So you might infect 8 or 9 other people if you have it. This one expert said, until now, the most infectious virus we knew for humans was the measles virus, and it has an incredibly high R number of 20 or 21. So each case could infect 20 or more other people with measles. But guesstimates of the R ratio for this Omicron variant is an astonishing 50, that one person may pass it to 50 others before they're recovered. That would explain why cases in South Africa went up 100-fold in less than a month. But the other two important questions are, is it any more lethal than the Delta variant? And will it be more resistant to vaccines than the Delta variant? And my guess, based on what we've heard so far, and most of this is anecdotal right now. There are no controlled studies of this yet. And it's just evolving right now. So every day and every week, we're going to learn more. And some of what we think we know now, we may find out differently later. But as for lethality, I don't think it's going to be any more lethal than the Delta variant is in terms of risk of death if you catch it. And in terms of resistance to vaccines, it's likely that it is going to be more resistant to antibodies or that produced by a vaccination than Delta and the other variants have been, but not so resistant that your vaccination was useless. For example, I think the first case that has been identified in Israel, it was a woman, and she had been vaccinated before with whichever vaccine Israel is using. I forget which one they're using. It's one of the big four, I believe. And she only got mildly sick. So it looks like, although she caught it and she was symptomatic, the vaccination prevented her from getting very sick with it. So, like I say, we'll know more. But another issue has been that there's been a lot of controversy about was shutting down air travel. Like the United States will have a ban on people coming in from 7 South African countries starting tomorrow, with a whole bunch of exceptions. If you're a U.S. citizen, if you're a U.S. Natural, legal resident, or if you're married to a legal resident, etc. So I guess it's okay to bring the virus in here if you're a U.S. citizen, but it's not okay to bring the virus here if you're not a U.S. citizen. We only want red-blooded Americans spreading the virus to us. And anyhow, many countries right away started initiating travel bans. Israel is banning all foreigners from coming into the country for, I think, 2 weeks while they study the situation to figure out what's going on. Is this good or bad? Well, a bunch of experts are arguing they didn't think it was good because South Africa picked up on this new variant pretty quickly. They have some good laboratories there, and they reported it promptly to the world. And they, in a sense, got punished promptly by international commerce being shut off. And tourism is a thriving business in South Africa. Now tourism is going to be devastated for who knows how long. So their reasoning is, what about the next country that crops up with a new variant? Or what about a country that crops up with another whole new virus? Are they going to be reluctant to report it to the world because they'll be punished economically for telling the rest of the world what's happening? That's a legitimate argument. On the other hand, I personally think it is a good idea to try to limit travel at least for a couple of weeks, which is what a lot of these countries I think are doing at the moment. Is they're not saying this is an indefinite ban. They're saying let's try to slow down travel, especially from these affected areas, while we learn more about the virus. It's not that we're going to stop it from spreading in the United States. As a lot of the experts have said, we probably have cases here already that we just haven't identified. No, it's not to prevent it from coming into the US, it's to prevent it from spreading too rapidly, to limit how many cases there are, spreading it around, so that we don't have another huge new wave, in half the country all at the same time, overwhelming hospitals so that there are no hospital beds available for people that need them, leading to people, as I mentioned before, dying in the emergency room or dying in an ambulance, waiting to be unloaded into the hospital, or dying at home waiting for a hospital bed because there are no beds, or because there's not enough skilled staff to take care of you. So that's the biggest concern. We can treat a lot of the patients that get sick if we have the beds and the staff. But when serious cases outnumber our facilities and our manpower, that's when the situation really becomes frightening, especially if it happens to somebody you care about. So I think a pause in the travel while we rapidly try to learn more about this variant was a good idea. The vaccine manufacturers are already looking at how they can tweak their vaccine to respond as best as possible to the new variant if they have to. And the estimate was it would take at least 100 days for them to modify their vaccines to more specifically target Omicron, or as I'm calling it, the oh my God variant of COVID. So that's what we know so far. It's not a lot. It looks like it's way more contagious even than Delta, which was more contagious than the original strain. Might not be any more lethal in terms of percentage of infected people dying or needing intubation. That remains to be seen, but we don't have evidence that it is more lethal. But heck, millions of people have died from the other variants and from the original virus already. So it's not like we don't want to take it seriously. It is. And vaccination will provide some protection against it. So the best things we can do at present is the people that weren't vaccinated, they should get vaccinated. If you had one shot, you should get the other shot, assuming you had Pfizer or Moderna. If you got your original vaccination and spend more than 5 months since you had a Pfizer or Moderna, or more than 2 months since you had J&J. Your best thing to do is get the booster shot now, because that booster shot is multiplying people's antibody responses several times higher than it was even after the second shot for the people that got 2 shots. The more antibodies, the better. And in addition, it's going to put more pressure on the states and cities to tighten up on mask wearing. I know people are sick of mask wearing, but wearing a mask beats dying or killing somebody else. So we'll probably see some increased pressure to wear masks in public in places where that had been eased up, and maintaining social distancing. Those very simple measures to just prevent how much virus is reaching from an infected person in the supermarket to you, an uninfected shopper, not catching what they're carrying. That's really it for right now. And I say, a week or 2 weeks, we'll have more information about the oh my God variant. I hope you had a good Thanksgiving.